Hello, it's Dr. Rhonda Johnson. Today is Sunday, September 24th, 2023, and today I'm talking about sickle cell disease because September is National Sickle Cell Awareness Month. Now, what is sickle cell disease? It's the most common inherited blood disorder in the United States. It affects approximately 100,000 Americans. You get this disease when you get a sickle cell, let's say, gene inherited from both your mother and your father. Now, sickle cell affects millions of people throughout the world with a wide range of ethnicities, although it's commonly thought of as a disease that only affects the Black community. It affects people of all races. Now, the disease gets its name because the protein in the blood, the hemoglobin, causes the cells to form crescent-type cells or sickle shapes in some of the red blood cells. They're normally round, and it causes the hemoglobin, it's called hemoglobin S, to sickle. Now, again, the red blood cells, when they pass these sickle cells, they get stuck in these tiny blood vessels called capillaries, and it deprives the tissues and the organs and the cells of the needed oxygen. And you know, all the cells in our body rely on oxygen for energy. Now, again, sickle cell can affect both males and females equally. It's diagnosed by blood screening of newborns in the United States. The course of it is a lifelong illness. One of the most common manifestations of sickle cell is a pain crisis, and they can start suddenly, they can be mild, they can be severe, they can last for any length of time. Pain typically occurs in the hands, feet, chest, and the back, and it can cause people to lose a lot of school days and miss work days. And long-term sickle cell disease can cause chronic anemia, blood clots, inflammation, and damage to the blood vessels, which contributes to organ damage. Some of the major organ damage that can occur includes strokes in the brain, damage to the lungs, heart, kidneys, eyes, gallbladder, liver, spleen, bones, and in addition, people with sickle cell anemia have an increased risk of infection, including the life-threatening infection called sepsis. Now, what about treatment? Well, there are medications that can help ease some of the symptoms. There are, in the last, I'd say, 5 years, there have been at least 3 new medications developed to help patients with sickle cell disease. And in certain situations, blood transfusions work to manage complications. Now, is there a cure for sickle cell disease? Well, currently, a bone marrow transplant is the only cure for people with sickle cell disease, but it's not common for people with sickle cell disease to get a bone marrow transplant because you have to find a good genetic match. You have to have a well-matched donor, and it needs to be done fairly early in the life course of a person with sickle cell disease. Now, researchers are also exploring gene therapies, and it is my hope that if not in my lifetime, at least in my children's lifetime, that there will be better therapies for people with sickle cell disease. Now, what about life expectancy? When I was in medical school many years ago, we were taught that the life expectancy of a person with sickle cell disease was around 30 years. And in fact, some of my patients and even a dear friend of mine lost their life to sickle cell disease in their 30s about that time many years ago. But there are advances in treatment, and now the CDC says the average life expectancy for someone with sickle cell disease is around 53 years of age. So again, progress, but we still have a ways to go. So that's my message today, promoting awareness of sickle cell disease. And I hope that if you know someone with this disease, that you can offer your emotional support or support in any way that you can. Take care, folks, and be well and be safe.